Hello, this is Joe DeStefano, Medical Director for Urgent Care 24/7. Life is 24/7 and so are we. I'm here today to talk about a very important subject to us at Urgent Care 24/7, a life and death subject, and that's COVID-19 and the Delta variant, also called the Indian variant because it was first discovered in India. You'll see a lot of disinformation on COVID-19 and the Delta variant, a lot of internet memes and Facebook posts. And a lot of it is information, but not necessarily presented in the full context. Let's talk a little bit about the Delta variant. It is COVID-19 with mutations to its spike protein that make it more contagious. It's not necessarily more deadly. It hits the same exact high-risk population that original good old boring COVID-19 hit. So if you are obese, BMI greater than 30, if you are hypertensive, or diabetic, or have a low vitamin D level, or you're immunocompromised from treatment of cancer or treatment of an autoimmune disease, or you're greater than age 60, you're at high risk for complications from COVID-19, whether it be the Delta variant or good old-fashioned COVID-19. Now, let's talk about natural COVID immunity and artificial and induced COVID immunity in the Delta variant. In the two most effective vaccines, which are my personal favorite, I chose to have Moderna personally, and Pfizer. These invoke very high level and high durability antibodies against good old COVID-19. The studies have shown that even one Pfizer or Moderna vaccine is about 78% effective in preventing infection with COVID-19. And the media will use that to say cause alarm. Oh, it will allow 32% of patients to get 22% of patients to get infected. Well, yes, but we don't care just about infection. We care about outcome, morbidity, and mortality. Even with one vaccination, your morbidity and your mortality is very, very low with COVID-19 Delta variant if you are vaccinated. It's even better if you've had two vaccinations. So a Moderna and a Moderna, or Moderna followed by Pfizer, or Pfizer followed by Moderna. These vaccines produce very high levels, very durable levels of antibodies that are good enough and sticky enough to get the Delta variant spike protein. I personally, in hospital medicine, having now seen Delta variant, have not had any fully vaccinated patients admitted. And the people that have been just one vaccine were not very sick and got better quite fast. However, if they were not vaccinated and had not had COVID previously, if you are in that high-risk category, which is a low vitamin D level, which we now really know is a vitamin D level less than 60, a hypertensive, diabetic, obese, immunocompromised because of either cancer chemotherapy drugs or drugs used to treat rheumatoid arthritis or lupus, this disease is devastating. Now, in the younger population, under 50, thin, marathoner, vitamin D level of 65, so you have no risk factors. The Delta variant is like good old-fashioned COVID for you. A low risk of, very low risk of hospitalization, very low risk of death. So when you look at all these numbers and you consider risk, if you're 51 years old, overweight, hypertension and a blood pressure medicine and say you don't know what your vitamin D level is, you're at substantial risk for COVID-19 Delta variant, just like you were for good old COVID-19 if you're not vaccinated. The other thing I want to really stress is that the most underemphasized thing in this COVID epidemic has been vitamin D. Vitamin D levels, basically, a normal, depending on what reference book you read, is 35 to 40. It has been shown that your best outcomes in cancer and autoimmune disease is if your vitamin D level is kept at 60 or above. And Harvard and other institutions have looked at vitamin D levels and have come to that conclusion as well, that vitamin D levels greater than 60, people do very, very well against COVID. Personally, my vitamin D level, I've checked it every 3 months during the pandemic, and I keep my vitamin D level 60 to 85. And I went through 18 months of the COVID pandemic, taking care of multiple positive COVID patients who were really sick. A lot of them we didn't know had COVID when we first started seeing them. I isolated later once we got the COVID test back, and I did not contract COVID or become sick, even though I do have risk factors. And that is what the literature has shown, is that vitamin D is an independent variable for mortality and morbidity in COVID-19. In all of my cases, and I am kind of a zealot, I check vitamin Ds on all my hospitalized COVID patients. I have only had one patient with a vitamin D level better than 65 that got COVID and did poorly, but he had multiple other risk factors. He also was greater than 65 years of age, also hypertension, coronary disease, multiple other risk factors. So really, this is the Delta variant. The Delta variant, the vaccines are very effective. We've been at this 18 months. We know we have to lose weight. We know we have to become a healthier society. We know we have to get our blood pressure under control. Good self-care, in addition to vaccination, is essential against the Delta variant, just like it was against original COVID-19. Now, in terms of people that had previous COVID illness, they look like they do very well against COVID-19 as well. They don't seem to be quite as impervious to it as vaccinated individuals. And again, medicine is an art. The body is complex. There's multiple variables at work. You do not know when you see these data points on previously infected people that are now ill with the Delta variant. Well, you don't know how bad was their original infection. Did they have a very low inoculum of the original COVID virus and only had to have a very mild immune response to shake it off? They weren't just like coated in the virus with a big exposure. You do not know necessarily what parts of the COVID virus their personal body targeted. So maybe they targeted the spike protein less than other parts of the virus. So when you develop a vaccine, it is normed for the dose to produce a predictable level of protective antibody. When you have just the COVID infection, Lord willing, you produced an antibody level higher than the vaccine would have, but you easily could have produced antibody less. The other thing we, of course, don't know about these reinfects with COVID-19 that were previously infected with the non-Delta variant is, did they do their self-care? Did they stay in their multivitamin, their zinc, their magnesium? Did they take their vitamin D supplement? Did they go to their PCP and say, hey, I want a vitamin D level? You don't know if the rest of their immune system was kept healthy, so when the Delta variant came along, they still basically had bullets in their guns to fight. As a frontline doctor with COVID-19, Delta variant, it's just like the original COVID-19. If you're high risk, you do not just sit at home and wait. You go seek treatment. You are monitored by a physician. There are effective treatments if given early. The expensive IV medications like remdesivir, even they will not save you if you wait 9 or 10 days to come and get treatment for your COVID. These are antiviral drugs, and just like influenza and Tamiflu, when you're dealing with viruses, you have to treat early. Late is very difficult to salvage. This is Joseph DeStefano for Urgent Care 24/7. Thank you for this very important talk about Delta variant. Life is 24/7, and so are we.